Hey everybody, I'm going to do this presentation on strokes and I'm going to try to do it real quick before I go to sleep. So, a stroke can occur, as y'all can see, here's your brain. Presentation on how strokes happen. A stroke occurs when part of the brain is deprived of oxygen and nutrients. Brain cells begin to die within minutes, which is why a stroke is called a true medical emergency. So, this is our little beautiful brain. And when it's deprived of oxygen and nutrients, a stroke can happen. We're going to talk about two different pathways. Two different pathways. The first one we're going to talk about is ischemic. The ischemic stroke is the most common stroke, and is 80 to 87% out of the other two. So this is where blood flow to the brain is blocked. So here you have your blood vessel, you have the brain, and these are blood cells here. And in between these blood cells is your blood clot. Now, blood flow is blocked. This right here, blood flow is blocked because this clot is blocking the blood flow. So let's talk about what causes the blockage. When it comes to blood clots, they often form in the carotid arteries or the heart, and they embolize, meaning they travel to the brain. This is one reason atrial fibrillation patients who have, or people, I should say, who have atrial fibrillation, their risk of stroke is increased because of the irregular heartbeat, which allows clots to form inside the heart. Sometimes, but not all the time. And because I'm doing this, I'm going to put out this disclaimer now. This presentation is for information and educational purposes only. If you have had a stroke or you have cardiovascular disease or you have clots, what I suggest you do is that you talk to your primary care physician about your health condition. But keep in mind that this presentation is only for informational and educational purposes only. It is not meant to diagnose or prognose. I just had to get that out there so y'all are aware. Next is arteriosclerosis. So arteriosclerosis is plaque buildup, and this is um, consistent of cholesterol, calcium, dead cells, fibrous tissue. Okay, so you have cholesterol, dead cells, calcium, and you have fibrous tissue. So over time, plaque builds up. And because it's building up, it will narrow the vessels, meaning that it's going to constrict. It's going to cause the blood flow to slow down because the diameter of the blood vessel is not wide enough, which may rupture or trigger a clot that fully blocks the artery. So I'm going to show you this next picture. Plaque equals cholesterol plus calcium plus dead cells and fibrous tissue. Okay? The next one we're going to talk about is hemorrhagic stroke. Hemorrhagic strokes are 13 to 20%. This type involves bleeding into the brain. So let's take a look at this picture. So we have our blood vessels here. The bleeding is here. This is the bleeding right here. You have a busted blood vessel, and this blood vessel is open, which means that blood cells is coming out. The blood is coming out, and you have bleeding in within the brain, which will have swelling and damage. This type of bleeding involves two things: mechanism. A blood vessel ruptures that's going to cause the blood to leak into the brain tissue, which you can see right here. Some of the common triggers are chronic high blood pressure, which weakens the blood vessel walls. You have some people that is on 2 to 3 or 3 to 4 blood pressure medications, but Chronic high blood pressure weakens the blood vessel walls. Then you may have aneurysm rupture, which is arteriovenous malformations, also called AVMS. Another cause would be trauma, rare anticoagulant medication overdose. Once again, this presentation is for information and educational purposes. If you have any of the um, conditions that I'm talking about, heart disease, circulatory system, or you have had a stroke, or you have had any type of stroke that I'm talking about, I suggest that you talk to your primary care physician. Okay. Bleeding causes increased intracranial pressure, compression of brain tissue, reduced oxygen delivery. Most important, reduce oxygen delivery. Okay. Bleeding in the brain, we talked about the common triggers and the causes. Next, we're going to talk about TIA, transient ischemic attacks, sometimes called warning strokes. Sometimes called warning strokes. Blood flow is temporarily blocked, but it's not permanent. So let's take a look at this blood vessel. So we have our blood vessel. We have our red blood cells. We also see this blockage right here. But this blockage is going to clear out. And if you take a look at this, it says temporary. You have reduced blood flow. Anytime you have a blockage of any kind, you're going to have reduced blood flow, period. So here we have the clot, but it clears. And this diagram is showing no permanent brain damage. But we're going to talk about a few things when blood flow is temporarily blocked. Symptoms resolve within minutes to hours. There's no permanent brain damage, and up to 1 to 3 people with TIA will later have a major stroke, making TIA an opportunity, which means transient ischemic attack, an opportunity for early intervention. So many strokes, no permanent damage. No permanent damage. But let's talk about why strokes happen in the first place. So, why do strokes happen? These are risk mechanisms. Number one, let's talk about vascular dysfunction. But before I go into that, I'm going to say stroke doesn't happen randomly. It's the end result of underlying mechanisms, which means to me, from a lived experience, to me, it's a cascade of events. This is how I this is how I summarize it. It's a cascade of events. Um, Something I want to say. I'm gonna leave it right there. I just want to get through this presentation, but I know eventually I'm going to say what I want to say. Vascular dysfunction is number one. This is when the arteries become stiff, they become narrow, or they become inflamed. High blood pressure, a surveys vessel wall damage. That's vascular dysfunction. And the second one is hypercoagulation, which is triggered by hyper meaning up. Coagulation means coag means clot, to form a clot. Coagulation, they're going to come together. Triggered by smoking, inflammation, metabolic syndrome, dehydration, high homocysteine, and hormonal medications. Certain cancers, hypercoagulation is triggered by. Cardiac sources, circulatory system, the heart. Heart conditions can send clots to the brain. Some of those heart conditions that can send clots to the brain, this is cardiac sources, send clots to the brain, is heart valve disease, heart failure, and medication induced risks. And we're going to talk about medication a lot. Hopefully, y'all have looked at the video I did for um, medication induced organ damage. If you haven't, just go watch that video. Certain drugs alter blood pressure. Just pay attention. Be with me. Certain drugs alter blood pressure. Certain drugs is a recipe for clotting. Certain drugs alter kidney function. Certain drugs causes vascular inflammation. This is why, everybody, polypharmacy, meaning multiple drugs, and I talked about this in the other video, multiple drugs increase the risk for seniors and cancer patients. I'm going to say that again. Polypharmacy, if you had not watched that video, medication induced organ damage, please go watch the freaking video. This is why polypharmacy, meaning multiple drugs, people's on a lot of drugs, 10 to 12 drugs that the doctors is prescribing for every condition that you may have, increases the risk in seniors and in cancer patients. Let's talk about what happens when the brain, what happens during a stroke in the brain. It's gonna be all, it's late. Once blood flow stops in 0 to 5 minutes, the neurons begin to fail due to lack of ATP. ATP is called adenosine triphosphate. ATP is also a energy source that is required. In 5 to 10 minutes, you'll have cell death spreads, toxin release, inflammation increase in 5 to 10 minutes. So this is the things that happen in the brain during a stroke. Right here, everybody, right here. In 10 to 60 minutes, edema, swelling increases, pressure rises, oxygen drops. Remember, oxygen drops because there's less nutrients and oxygen getting to the brain. And this is why it is said time is brain, because every minute, meaning 1.9 million neurons is lost every minute when a stroke happens in the brain. Okay? Now we're going to talk about, I want to go this way. Real world triggers. Let's talk about why strokes disproportionately affect Black and brown communities. And I'm learning from talking to people. This happens a lot. So let's get into some of these major contributors. Uncontrolled hypertension, diabetes and insulin resistance. CKD is chronic kidney disease, which affects vascular health. Lower access to preventive care. Stress load and environmental factors. And diet and food desserts. Medication management gaps. Delayed emergency room representation, meaning delayed help. Mistrust of the medical system. Mistrust of the medical system. So I also wanted to share with you, how do you know a person is having a stroke? So acronym BFAST: balance, loss of balance, headache or dizziness. Eyes, blurred vision. Face, one side of the face is drooping. Arms, arm or leg weakness. speech, speech difficulty like it's slurred, and time to call for an ambulance immediately. So I want to end with this. Thank you for being here. Share the presentation. Take heed to what's in the presentation. Strokes are definitely a medical emergency, and please, if you see anybody with these signs, you want to call 911. Thank you for being here and share the presentation. Thank you. See you on the next video. Bye-bye.